The spinal cord stimulator is a device that can be implanted sometimes by a pain physician, more often by a spine surgeon or neurosurgeon. It's a device that it doesn't alter the nervous system per se. It's not a type of surgery where you're making a lesion or changing the function of the spinal cord or the brain. It's inserting an electrical device that, using electric current or a field of electric current that's delivered through a stimulator similar to a pacemaker battery, it creates an electric current around the spinal cord that alters the transmission of pain. So when we put the stimulator leads in the lower thoracic region, it can cover back pain, hip, sacroiliac, legs, everything from here on down. If we put the spinal cord stimulator leads in the neck, it would help with chronic neck pain and chronic arm pain. What the spinal cord stimulator does is turns down the transmission of the pain signal to the brain. You can still feel your legs. You can still feel all the things you need to do to put your shoes on and to walk, and you can still feel other noxious stimuli. If you cut yourself or have a mosquito bite, you'll still know. What the spinal cord stimulator does is takes the inappropriate signals, like the feeling of burning in the legs or in the back, and prevents those signals from getting to the brain. Patients that have a spinal cord stimulator oftentimes are able to do many things and get back to a regular life that they couldn't do before. And many patients with spinal cord stimulators are able to get off of the medications, including narcotics, or go down substantially on the amount of medications that they take because their pain is so much better under control. The best indication for a spinal cord stimulator is chronic pain that can't be treated another way. Some of those patients, unfortunately, have gone through multiple, much more invasive spine operations like spinal fusion surgeries or laminectomies. Some of the patients have tried many different medications and alternative therapies to help with pain. The type of pain that is treated in the best way with the spinal cord stimulator is called neuropathic pain. What that means is that the nerve fibers in the leg or the back are sending signals to the brain that are inappropriate. They may be telling your brain that your legs are on fire, for instance, which is extremely uncomfortable for patients. I think the best thing about a spinal cord stimulator is not only will it help most people, if we run into problems, it turns out not to be the best solution for them. Nothing's perfect. It's not altering anything about their brain or their spine or their nervous system by taking it out again. It's no harm, no foul. We gave it a good try. In order to help with that situation, we typically do a trial where we put the leads in the office. One of our pain doctors will do that with x-rays. And they'll walk around with a battery on the outside. It's about the same size as the pager that I would walk around with. And they'll give us a week and tell us how that works for them.